Aphorism 206. Before commencing the treatment of a chronic disease, it is necessary to make the most careful investigation as to whether the patient has had a venereal infection or an infection with condylomatous gonorrhea. For then the treatment must be directed towards this alone. When only the signs of syphilis or of the rarer condylomatous disease are present, but this disease is seldom met with alone, no ways. If such an infection have previously occurred, this must also be borne in mind in the treatment of those cases in which sora is present, because in them the latter is complicated with the former, as is always the case when the symptoms are not those of pure syphilis. For when the physician thinks he has a case of old venereal disease before him, he has always or almost always to treat a syphilitic affection accompanied mostly by complicated with sora for the internal itch. Dyscrasia, the sora is far the most frequent fundamental cause of chronic disease. At times, both miasms may be complicated also with psychosis in chronically diseased organism, or as is much more frequently the case, sora is the sole fundamental cause of all other chronic maladies, whatever names they may bear, which are moreover so often bungled, increased in, and disfigured to a monstrous extent by allopathic unskillfulness. Explanation. In this aphorism, Dr. Henneman has given idea about investigation of cause of chronic diseases. Before starting the treatment of chronic diseases, it is necessary to make the most careful investigation as to whether the patient has history getting venereal infection or an infection with condylomatous gonorrhea. The treatment must be directed towards this alone. Single miasm, when only the signs of syphilis or of the rarer condylomatous disease are present. But this disease, syphilis and condylomatous, are seldomly found alone nowadays. If such a disease has occurred previously, we should keep in mind that sora must present, because in such a chronic disease, sora is complicated with syphilis or psychosis. So you can found always symptoms are not purely of syphilis. When the physician get the case of old venereal disease before him, he has to treat this syphilitic affection accompanied or complicated with sora, because the internal itch, dyscrasia, sora is the most fundamental cause of chronic diseases. At times, both these miasms, sora and syphilis, may be complicated with psychosis in chronically diseased organism. In most frequently, sora is the sole fundamental cause of all other chronic diseases, whatever names they have. These chronic diseases often gets more complicated, increased in intensity, and disfigured to monstrous extent by unskillfulness of allopathic doctors. Footnote 206. Footnote 120.